Hi everyone. Today we're talking about a really important topic during pregnancy, and that is how dehydration can contribute to preterm contractions and what's really going on with the amniotic fluid and what you can do to support a healthy environment for your baby. So let's start with getting into dehydration. If you're not getting enough fluids, your blood volume can actually decrease. And when your blood volume goes down, so does the blood flow to your uterus and placenta, which then reduces blood flow that can trigger the release of oxytocin, which are the hormones that causes contractions. There's also another hormone called vasopressin, which your body produces when you're dehydrated. And guess what? It's chemically similar to oxytocin and can also cause uterine contractions, which then leads to preterm contractions and, in some cases, preterm labor. So, staying well hydrated isn't just about feeling good, it can actually help keep your baby where they need to be for as long as they need to be there. Now let's clear up a common myth, right? We always hear that your babies are swimming in their own pee. And while yes, your baby fetal urine does contribute to the amniotic fluid, it's not like adult urine, and it's definitely not dirty. So starting in the second trimester, babies begin to release sterile urine in their amniotic sac. But the fluid is part of a complex, constantly circulating system that includes fluid from the baby, the placenta, and the mother. And so here's something super cool to know. Babies actually swallow the amniotic fluid, which helps develop their lungs and digestive systems. That swallowed fluid is then absorbed in the gut, processed, and recirculated as part of this amazing natural system. So no, your baby isn't just floating in waste. The amniotic fluid is actually filtered, balanced, and essential for their growth. So let's talk about if your amniotic fluid levels are concerned. And if they're a little low, what are some things we can do that can help? Don't forget, hydration is key, right? That's going to be the number one thing, is drinking enough water, which can increase the amniotic fluid, especially if you're just mildly low. Now, in some cases, doctors may use IV fluids to help boost those levels quickly. And then eating a balanced diet with enough protein supports your overall fluid balance. Lying on your left side can improve blood flow to the uterus, which may also help. And during labor, there's a procedure called amnioinfusion, where fluid is added to the amniotic sac through a catheter. But that's only used in specific medical situations. Now, let's talk about how your fluid stays fresh and clean. Okay, so this is a constant process. Your baby swallows the fluid, absorbs it through the digestive tract, and their kidneys filter it and send it back out as sterile urine. At the same time, fluid is being added from your own blood supply, passing through the placenta and amniotic membranes. In fact, the entire amniotic fluid volume will be turned over every few hours, especially later in pregnancy. It's a dynamic self-cleaning system that works all day, every day to support your baby. So that was a lot of information real quick. So let's recap. Dehydration can lead to preterm contractions through hormonal changes. Amniotic fluid isn't pee the way we think of it. It's sterile and essential. And you can support healthy fluid levels by drinking water, eating well, and resting on your side when needed. Don't forget, pregnancy is incredible, and your body is doing amazing work every single day. Keep taking care of yourself, stay hydrated, and always reach out to your provider with any questions.